As a busy working mom of almost two, there are a few things I continue to prioritize with each pregnancy. One of those is exercise. But how much is too much? Let's find out. Hi everyone, welcome back to the channel. I'm Dr. Lauren Linus, Doctor of Physical Therapy, and today I want to dive into my personal journey with exercise and pregnancy. I want to start by saying that I am not a pelvic health specialist, nor am I your OBGYN, but we will be chatting with an expert who has a very cute baby, so stick around. If you have any specific questions regarding your fitness routine during pregnancy, please always consult with your care team. My aim for today is to share with you some personal insights surrounding what has worked for me, what hasn't, and answer the burning questions of what type of exercise can I do during pregnancy? How much exercise should I be getting? Are there things I shouldn't be doing? Let's dive into it all. For me, my exercise of choice has always been running. With pregnancy number 1 and this pregnancy, I made an effort to continue with running as long as it felt comfortable and safe for baby and I. Now, running when you are carrying around a watermelon doesn't just happen. It definitely takes intentional strength training and pelvic floor training to be able to continue to get a few miles in each and every day. And while I'm not a pelvic health specialist, I do know someone who is, and we're gonna give her a call and put her in the hot seats when it comes to answering some common questions surrounding running during pregnancy. Hi, Lindsay.
What a treat.
What a treat. Hi, Luca. Would you like to tell the people of YouTube about who you are and what you do?
Well, hello, rehab world. My name's Lindsay.
Hi, Lindsay.
I'm a physical therapist. I specialize in working with pregnancy and postpartum and female athletes. Pelvic floor health and pregnancy is kind of my bread and butter. But on top of being a PT, I'm also a mom to this little dude.
Great. Are you ready to answer 3 questions for me about running during pregnancy?
Yeah.
Question number 1. Can you run when you're pregnant?
Can you run when you're pregnant? Absolutely, yes. If you want to run when you're pregnant. Running when you're pregnant is great, and for most people feels really good. What we typically recommend
Luca, simmer.
is still getting 150 minutes of moderate physical activity when you're pregnant. So if you're someone who enjoys running, running is totally safe to continue to do while you're pregnant.
Amazing. What pace should people run when they're pregnant?
I mean, the best way to answer that is it totally depends on what feels comfortable. Pregnancy isn't a time to maybe jump into running if you've never ran before and decide that you're just going to start hammering track workouts. But really, it's whatever feels most comfortable for you. I would say most women tend to find that running a little bit slower than maybe their normal pace feels the most comfortable during pregnancy. But there really is no hard guideline on running a certain pace. What I tend to recommend for my patients is if you're able to hold a conversation while you're running, that's usually a really good place to be if you're pregnant.
That's good. That's good. Okay, and then typically, how long does it take women to get back to running after pregnancy?
Also a great question. Like everything in PT, it depends.
Yes, so true.
The big umbrella answer is 6 months is what we really recommend, no matter the form of delivery. But that doesn't mean that that's a one size fits. Depending on your activity level during pregnancy, depending on, your labor and delivery, some clients get back to running a lot sooner and feel great. Some clients really do take that full 6 months, and that's also great. The biggest thing is we just want to make sure that you get back to running safely and pain-free, so that you're not at risk of injury or experience any pelvic floor symptoms or dysfunction in your build back up to running.
Okay, I have a bonus question for you.
I love bonus.
I know you do. If you were to give just one exercise to patients in order to have them continue to run during pregnancy, what would it be?
I would give them a child's pose with pelvic floor relaxation.
Ooh, love it.
Yeah.
Great exercise.
I think a lot of people assume that pelvic floor strengthening is all about contraction of the pelvic floor muscles, which is great and certainly appropriate a lot of the time, but especially later on in pregnancy, we really want to be intentionally lengthening and relaxing our pelvic floor muscles because they really work as a kind of like a spring when we run to absorb force. So as we get bigger during pregnancy, our pelvic floor muscles a lot of times naturally will become a little more tense as they try to support the growing baby. And so a lot of times what we really need to do is teach those muscles to relax so they can absorb the force of running, as opposed to just always being in a short and tightened position. So child's pose, pelvic floor relaxation would be my go-to time and time again.
Excellent answer. Well done. Well done.
Bonus.
All right, that's all the people of YouTube wanted to know.
The people of YouTube. All right. Luca wants to say hi to the people of YouTube.
Hi, dude. I'm able to continue running because I prioritize exercises such as the one that Lindsay mentioned, focusing on intentional single leg work, breath work with pelvic floor relaxation and contraction, and being okay with slowing my pace are things that likely need to happen to allow you to keep running. I also want to mention here too that I have been running for a good 10 plus years. If you're wanting to pick up a new form of physical activity, typically doing it during pregnancy isn't always encouraged. Please be sure to have those conversations with your care team before beginning training for your first marathon. All right, before we jump into other forms of physical activity that I am prioritizing, let's answer the burning question: how much is too much? Exercise is encouraged and should be performed when you are pregnant. A systematic review performed in 2023 identified that women who had a sedentary lifestyle during pregnancy were at a higher risk of serious complications during pregnancy, such as a DVT, obesity, and complications to the baby. Even those who have been sedentary before should begin an exercise routine, even if it starts with just 5 minutes a day of walking. So, what's the ideal number of minutes we should exercise per week? As Lindsay mentioned, ideally if you are pregnant, you should shoot for around 150 minutes of moderate exercise per week. This can be split up into smaller digestible chunks, such as 30 minutes per day, 5 times a week. I prioritize getting in a longer run, 25 to 30 minutes, 3 to 4 times a week, and then a shorter run with my lift sessions and pelvic floor training, 2 to 3 times a week. This allows me to get in 5 to 6 days of exercise and helps me to stay energized on those days when chasing around a toddler seems like a lot. Remember, getting exercise in doesn't have to look like running. It can include walking at a brisk pace, swimming, stationary bike. Movement is movement. Keep in mind, however, that we do want to stay away from contact sport. Those are generally unsafe during pregnancy. If you have questions about what activity is right for you, definitely chat with your care team. On top of my pelvic health exercises, I'm also spending time lifting weights in the gym. Now, I've never been one to lift a lot of heavier weights, so my weights have stayed relatively the same, with modifications made as needed. I'm working a lot on breath work with strengthening to prioritize pelvic floor health. Core strength and lifting mechanics are a must because lifting a toddler off the ground doesn't stop when you are pregnant. And I prioritize single leg work to continue to feel confident and healthy while running. Remember, just because you are pregnant does not mean you have to stop working out. In fact, it means you should continue to prioritize physical activity. Find a care team who supports you in maintaining a healthy and active pregnancy because you and your baby are worth it.